Hello, welcome back to the NWorld. Let's get started with another engine style and NCLEX question of the day. So there is a 38-year-old client with a gravidas 6 and para 6 at 40 weeks of gestation. He's admitted to the labor and delivery unit for a scheduled induction of the labor. So this is the background information they give you, like why this client is in this scenario today. A vaginal examination is done and it is determined that the cervix is about 80% effaced and 4 centimeter dilated. The client is not experiencing contraction. So this is what we notice on a vaginal examination. And on the assessment, we see there is no contraction so far. So the doctor, obstetricians prescribe IV oxytocin for this. Now, the nurse starts the oxytocin infusion as per agency protocol and monitor the client and the fetus on the fetal monitor to determine the effectiveness of the oxytocin. So basically they give you a case study related to the oxytocin drug. So once you know a little bit about the oxytocin drug from the knowledge that this is a stimulant, the oxytocin is used for the induction of the labor. It can also used to reduce the postpartum hemorrhage as well, to control the bleeding. This can also be used for the incomplete abortion as well. So once you have a brief knowledge with your studies like this and you read this case study question, now let's see the question related to this case study, how to attempt this question. So for each assessment finding, click to specify if the finding is consistent with the therapeutic outcome or the adverse effect of the oxytocin. So we need to figure out which one is expected, which one is not expected with the oxytocin. And based upon that, we need to figure out the answer, right? Now, each row must have one response option selected in this case. So that means we cannot skip one of them. We must need to address each of the options. So either this is expected, which is therapeutic outcome, or either this is not expected, which is the adverse effect, right? Or adverse outcome. Now let's get started. So the first one we have in assessment finding is altered mental status. We are not expecting with a client having an altered mental status after oxytocin. So this will be adverse outcome. This is not the expected thing. So no therapeutic outcome, right? Same thing, adventitious lung sounds, which we are not expecting again in the client. So again, this is adverse outcome. And yes, definitely, we are expecting contractions every 3 to 5 minutes, lasting 45 seconds each, because before, if you see the case study, the client is not experiencing contraction. So now a client experiencing contractions every 3 to 5 minutes, and which is also lasting for 45 seconds each, so which is a good sign. This is something we are expecting, so this is therapeutic outcome. Sudden pain between contraction, not a sudden pain, but it has to be gradually, right? So the intensity has to be gradually. So not a sudden one. Sudden is always bad. So let's take this as adverse outcome. And decelerations on the fetal monitor, that's something we are not expecting with the baby. Take it out, so an adverse outcome, it will be there. And the last one, which I already discussed, so pain intensifying gradually with contraction, definitely we are expecting that. So this is going to be therapeutic outcome. I hope you like this engine style question as well. And that's all about for this video. For more videos, more question practice, keep watching the NWorld Review channel. Like and subscribe our channel as well. Thank you so much. Have a great day.